professionals don't work in isolation anymore, especially given the context of inclusion that we are talking to, especially given the context of remediation that we are alluding to. As the Department of Educational Psychology, I did tell you that from the center's perspective, we would be having stakeholders and other people joining us in terms of looking at how best together as multidisciplinary teams we can chart the way forward in terms of responding to the needs of learners. What one sees here is indeed that multidisciplinary teams are a necessity. We cannot do it alone. And it depends on you when you are now at your context. What is it that you find? Who is there? And how best can you mobilize resources which will let you become a person who is using the multidisciplinary process at the end of the day. This is why we would be looking at what we say in terms of teaching pedagogies of cooperation. As the multidisciplinary teams work in different forms, they come from different perspectives, everything is different. But we need to be looking at learning according to these in terms of what they refer to as workshops on new pedagogies. And here we are really thinking of these 13 aspects which become important in trying to help us. We have had, for example, issues of blended learning, cooperative learning, design thinking, which is talking to what we are doing right now in terms of the last assignments that we are busy grappling with. I do apologize that I have not been very active because of issues that are beyond my control now, but which actually says to us that we really need to think out of the box. I did talk to the idea that we engaged part of the teams, part of the stakeholders to help us. One of the things that we are lacking in terms of what we are doing are the issues of gamification. We spoke about this earlier in relation to what we are doing. But the issue of multiple intelligences is now being questioned. Literature is questioning that a lot and trying to say, is it all about multiple intelligences, or is it about what Dion referred to as the particular abilities that a student has? And then this is where we have to improve. Neuroeducation is new to us. Dr. Jean has been doing it for a long time, but for the majority of the people is really very new, and it's something that, from my perspective, needs to be approached with utmost care so that when we do it, we don't overemphasize one aspect of neurodiversity over others. I'm saying this because we have been working with the ETDP SITA to try and find a way that we can develop modules which will speak to the aspect of inclusion, the aspect of disability. I think 4 modules were identified, 2 of which I can remember. One is on neurodiversity. I was instrumental in developing that. Another one is on autism, again, instrumental in that. There was also another one of deaf education, and plus another one on visual impairment. All these are done as a way of trying to triangulate and bring together disciplines that we think can help us. We have problem-based learning here. A lot of us, we take this as at a face value, but this is very, very complex and really demanding because you are confronted with a situation that you have to resolve, and no one will give you answers there, but you yourself sits down with what is in front of you and try and find out how best can I problem solve this particular challenge that I'm facing, and what resources do I have. This is why now the thinking about the multidisciplinary approach comes in to say, who else can I need who will be helpful in the space where I am. I want to use an example of a lady I'm co-supervising at the University of Cape Town. She is deaf. I have no sign language, and for us to be able to communicate, I definitely need someone else to help me in that regard. And it becomes very, very difficult and challenging, but it's a question of how best then can I be multidisciplinary in my approach and find ways of helping her. Then we have the STEAM, and then thinking-based learning, which again becomes problematic because a lot of us want, it's easy to feel that I have information that I need, but it must be given by somebody else. And as and when that is happening, it allows for easy learning. And learning, I think if it's easy, probably is not that profound, and that is my personal opinion. Somebody might have a different aspect. We're saying that these pedagogies of cooperation and solidarity here, Kani says that pedagogies of cooperation and solidarity should be based on shared principles of non-discrimination. Most of the time we speak of universal design of learning, but here the colleagues are saying shared principles of non-discrimination, respect for diversity, respect, reparative justice, and framed by the ethic of care and of reciprocity. This is where really it becomes very challenging for us as teachers, because more than just being a teacher in remediation, the ethic of care becomes central to what we are doing. It goes on to say that of necessity, they require participatory, collaborative, problem posing, and interdisciplinary, intergenerational, intercultural learning. We are currently confronted with a shift in how teaching and learning takes place. Today, when we grew up, the thing in learning was reading. Today, it's more multimedia type of learning that becomes appealing to the learners. And it is a culture that most of us, the earlier generations, were not used to. So the intercultural learning becomes very important, because the culture of learning then and the culture of learning now and the culture of learning in the future will be very different. Hence why even in the ways that we engage in assessment should take cognizance of all of this and help us find best ways of helping our learners to benefit from the learning situation. And it says that also such pedagogies are both nourished by and contribute to the knowledge commons and continue throughout life, recognizing the unique opportunities of each age and level of education. This is what you are used to, and one cannot overemphasize. So some of the teams in the interdisciplinary approach could involve the psychologists, who would be looking at the emotion, the mind, and the body. I want to again refer back to the earlier lesson in terms of referrals. If you are allowed to refer, who do you refer to and why in this particular instance? I saw a note by Dr. Jean that teachers are not allowed to do this and that. This is why, because we are ruled by the over and above the ethic of care, but our disciplinary ethics also in terms of not crossing over the boundaries. An example, if I'm not a person who is trained in occupational therapy, I cannot claim that this is what I can do, and yet it is not my space. So these aspects become very important that we do understand, so that when we refer to the right people. The neuropsychology is looking at the emotions and functions. This is something that is there under the Health Professions Council of South Africa, but it's new. And I was talking to a colleague now yesterday, trying to find out how many of these people are out there, if anyone knows. I think Prof. Jean might have an idea of how many neuropsychologists are there. As I'm saying, it's a new field, and even in the boards, there's very little in the board of psychology. Then there are not many of these people who have, because it's not been there before. And then we have neuroscience, which looks at the function and the brain and the body. And these are the people now who get into the mechanics of how the body and the mind work together, so that they allow us to be able to function the way we are supposed to be functioning. I've seen a few of Dr. Jean's presentations looking at the brain and the neurons and all those and how they function. This is very important, because then it says to us, this is a way that helps us now to be able to say, if what I'm observing with the learner is presenting these particular issues, then who do I refer the learner to? Unfortunately, I'm not sure how many neuroscientists we do have in South Africa. As I said, this is a new field. I know our colleagues in the University of Cape Town, they are there, but they seem to be working not at the national level per se, but in Western Cape, they are very strong there. But however, when you come to this side, it becomes another issue that we don't have. Now, I know that I will always be crucified by trying to recruit from the younger cohorts that are the younger people that are in our class, to say, I'm not sure if in the space of neuropedagogy, we really do have someone here who can come forward and say, I'm really trained in this particular issue and I can take care of it. But let me ask, Dr. Lees, do you know anyone who is trained in South Africa in terms of neuropedagogy?
Not really, Prof. There's a lot of people with a lot of experience, but not anyone that's specifically trained that I know of. Yes. Maybe Dr. Jean knows.
Dr. Jean, do you know anyone?
Morning, Prof. Not specifically. I know that there are pediatricians that are specifically focused on neurology, and there are lots of psychiatrists and psychologists who focus on that. But if you're talking about someone in the educational sphere,
yes.
I think that is definitely a sphere that is still under serviced.
Thank you so much. Thank you so much.
Thanks,
so colleagues, thank you so much, man. So colleagues, this is another area that perhaps some of you thinking forward in terms of what you want to do, you could look at, because it looks really at the learning, the function and the emotions of people with neurodiversity. And as we are all agreeing as the professionals in this space, that not much is happening here. We have at the center been fortunate to have our Vice Chancellor developing a scholarship that looks at what we refer to as studies in neurodiversity or neurodiversity studies. So this can be part of an area that someone can apply for the scholarship and then develop a master's level dissertation and go through this and lay a foundation for us, because we are really in need as we are agreeing in this. Then we have school psychologists. I saw that in one of Dion's slides that came out, that they're out there and they deal with emotions and learning. But we also have educational neuroscience. This is again new. And it could be that other part that we could consider in that. Pedagogy, all of us probably are very familiar with this, but these are some of the multidisciplinary teams that when we are in this space of remediation and learning support, we could be thinking of. And it's important, as I said, that we are not working in isolation. Rather, we need to find teams that can help us and help the learner to be supported in that. I have alluded to this slide. We can go on and look at what we refer to as the 3 models of collaboration, because we have been talking about multidisciplinary approach, but how do we do it? And these colleagues are suggesting that all forms of collaboration involving more than one discipline of profession are what we call a multidisciplinary collaboration. Professionals work from the perspective of their own discipline. And I can bet and tell you now that although this is the situation, it eventually becomes a bone of contention because of our own inclinations now as people. And this is what you will have to manage once you decide, okay, fine, I'm going to take this team, that one. People are going to fight for space and for recognition in the space. And you will need to be in a position to be able to regulate that. So the interdisciplinary collaboration is defined as a complex phenomenon. I've just alluded to that. In that is often formed between 2 or more people from various professional fields to achieve a common goal. This is very, very difficult and not easy to come by. However, when we are in the space of saying, develop case studies, develop this, develop that, develop this, this is in preparation of allowing you the space to see these complexities that we are talking about, in that at the later stage, when you are back in the field, you may find someone who is dealing in a different discipline, and there is need then to synchronize how you work in the spirit of supporting our learners to achieve their goals. And it says here, this collaboration occurs when colleagues from different disciplines work together in order to learn about each other's field. This is another challenge, because can you imagine now, you are in education, you want to bring in occupational therapists, they need to learn how you work and you need to learn how they work, so that together there is that synchronized understanding of how best to support our learners. And again, we are saying that the multidisciplinary IEP teams could include and should include a parent. Parents are critical. Last week when we had our strategy, as I had said, we had one parent who didn't speak English amongst us. And there was, for some reason, sitting on one part of the hall. And I realized that they were not very interactive. Then I asked colleagues, please feel free to express yourselves in your own language. Immediately, hands got up because these people were bottling how they were feeling inside. And this parent said, what we need is people to reach out to us in the rural areas. All knowledge, all the teams are working comfortably in urban areas, but no one reaches out to us there. She said when her child was diagnosed with autism, no one could explain to her in a way that she would understand what is it that she's actually dealing with. So when we sent out a call, she was really anxious to come out to try and understand further what is it that they are dealing with. So again, apart from the parents, general education teachers are most important because you remember what I have been drumming up, saying that if there are people I respect are teachers or educators, because these are people who spend a lot of time with our children. A lot of time they face the challenges and they have to find out ways of how to get out of those challenges successfully. And then a representative of the school district and an educational professional who can interpret assessment results. Here again, it refers back to the scholastic module that we were referred to earlier, in that we are trained how to do some of this, but we should be quite aware, we should be quite cautious in terms of what is it we are allowed to do and what it is that we are not allowed to do. In that case, that's when you become a multidisciplinary team player, and then find people who can help you in that. And the team can include more professionals depending on the context, depending on the case. It depends really on your needs where you are and how best those can be addressed. Because eventually, again, you don't want to bring out in too many people who are going to confuse the situation. As we said earlier, the multidisciplinary approach is very complex, and the complexity is that people work from their own particular knowledge, their own particular training, their own particular work ethics, their own particular ethics of care. Everything is different. And as remedial educators, we have to be aware of that. There are advantages and disadvantages, and here it says that the advantages are that the teacher acts as the case manager. So you are the overall responsible person, but be aware that other professionals might want to overshadow that and tell you what to do, how to do it, and when to do it. As I said, I am in Toyando now. We came with engineers and other people from all types of faculties. And being from education, truly speaking, we're always being looked down upon. And what we were suggesting, everyone was throwing out the window. Little did they know that eventually it will be us who will be remaining here and doing what we need to do, because of the context that we found ourselves in, which called for educators. We will be coming back here, and unfortunately in this module, we don't have people probably who would be interested in issues of career guidance. We might have to resort to Dr. Jean to ask which students might be willing to come up this way with us. And I must admit, it is in a deep, deep, deep rural South Africa. And what we found there is really shocking. But we need to pay attention to that and help as much as we can. So again, there is one central point person so that you don't confuse everyone and they don't know what they are doing. And another advantage is that team members must gather for planned meetings and work so that they reach consensus on decisions. Individual expertise, yes, it's recognized, but no one discipline must overshadow another. We are a team and we don't work for our own professional identities. We are working to help the learners feel and enjoy support. It's not about us. So the focus is on team identity, not individual discipline identities. As I said, we came here as different teams. Now, when we go to these villages, the villagers don't see these differences. They don't know these differences. They see people from the University of Johannesburg. And that is the team identity that we must portray. However, members work independently because I cannot claim to work in solar stuff or even internet that has been developed here. But I will approach things from education perspective. That is the independence. But in other things that need to be done, we work as a team so that the intervention, collaboration, and sharing of information becomes important. And it doesn't, again, confuse the community. The disadvantages are that most of the time, what we do can be direct, but often isolated in terms of the student in the classroom and the environment. But again, students may receive limited service due to limited therapy time. This is very important. When we came here, we were made aware that we were going to conduct a career fair. And then in the discussions, it became clear that on the day that we are supposed to be back here, there's really not going to be time for that. Hence why it was important that we thought, okay, fine, why don't we become proactive and train teachers? This way, they can continue with support of the students even when we have left. This is the decision making that we have to make on the ground. No one will tell us that this is the way to go. The decision is dictated by the context that we find ourselves in. And the decisions are driven by orientation of each individual's discipline. The others that were within the team fell off, but we remain as the team that is relevant. This is why this is important to consider. Now, again, this model, it may perpetuate the idea that students with disabilities attend school for therapy rather than educational services. I was constantly warning my colleague that what we were doing now is more educational than clinical. And we have to be always aware that what we are doing is actually learning support, not therapy. And once we begin to wear the goggles of a therapist, then the whole approach becomes different. So this is just an anecdote that was out there that says these parents are actually, getting themselves ready to go for their child's IEP meeting. And you can see the spirit of fighting that already is in this family. Now, the question is, if this is what is showing itself, what is going to be the context once they get to the school? And as I said, now imagine yourself, it is this parent and you are the leader of the multidisciplinary team. How do you contain this? And then just by way of some of the multidisciplinary teams that we could be looking at, we know that it is all about the learner. It is all about the child, and everyone else around this works towards supporting the child. I heard in the last lecture that Bronfenbrenner's ecosystemic approach should be in the forefront. And indeed, some of these are based on that. And you can see that what happens here brings different people. I have been referring to occupational therapists, and I've been talking about you as the educator, but here again, the family becomes important. And in some contexts, I don't know if this is the case with us, we have family support worker. In the last week, the exercise that we had brought that a lot, in that we have to have someone who goes from door to door trying to find out how best can families be supported so that they don't feel isolated, like the lady I referred to earlier, who supposedly had been grappling with her child's issues alone and feeling very much lost. And then there are daycare facilities that can be used as part of the support, and speech pathologists. This is very much true in terms of also autism and non-speaking students. We would need this type of a discipline to be in the. Now, this is the one from Dr. Jean. I found it somewhere, and she's, talking about what we know, mostly the SBST teams could be actually those that also help us in this space. And then the multidisciplinary teams. Our context, I think, the medical practitioners, the therapists, OTs, and audiologists, we show speech therapists that side. And we were made aware that there is the pillow pepper train. I'm not sure if any of you have come across the services and facilities that are on that train. But in the last session we had, we were encouraged that for sure we will be working towards trying to have neurodiversity in that space. And yes, go ahead, ma'am. Someone wanted to comment? Okay, fine. So we will be working from the UJ side to try and see if we can have space in that in terms of neurodiversity. What this means is that the people who are in this class, wherever they are, we might come back to you and say, okay, fine, the train this time is going to be in East London. Who is there who has been our student? And then you can offer your time there, maybe for a day or two, or however the case may be, even if it's 30 minutes, 40 minutes, just for people to come, and then you talk about what you learned in this particular class. And then other classes, and also say, what is it that you are suggesting could happen? It will be a new space, it will be a new opportunity, but it will allow us now to put into effect what we have learned. We will be seeing how best we can do this. I know Dr. Jean has trained a lot of people, for example, around the country, but mainly is in East London, who can help us in this particular space. Of course, other provinces also should have representations, because what the train does is that it becomes stationary at one particular time, addresses all issues of health. And you have dentists, you have physiologists, you have everyone there. But if neurodiversity can have a space there, it will be really very helpful. And this is the model that we will be building on in that particular space. So this multi-disciplinary support also calls for alternative teaching. If we were used to the traditional way of teaching, that is why earlier on I referred to neuropedagogy, so that we have people who are trained in this. And I have said there are opportunities. The question of how best do we look at these and develop ways that will help us create knowledge from the South African perspective. So the majority of students remain in large group setting, while some students work in small group setting for pre-teaching, enrichment, reteaching, or other individualized instruction. And the alternative teaching, therefore, allows for highly individualized instruction to be offered. This will be a challenge in South Africa, I know. But remember that we are the ones who will bring change in our education sphere. And as and when everything is happening, what we are learning and how best we are preparing ourselves for the outside world to be able to resolve our problems on the ground would be very helpful. So teachers should be careful that the same students are not always pulled aside, because this could be, seen as excluding them, and then compromising their learning as it is, and it may not be necessary that we do it, quite often to make them feel that they are being isolated. So principles for dialogue and action, interconnectedness, and interdependencies should frame our pedagogy. I'm back to Kani again, and they say that again, cooperation and collaboration must be taught and practiced in appropriate ways at different levels and ages. Earlier on in our other classes, we did emphasize the fact that sometimes as a lecturer, as a teacher, you may not reach the children as much as their colleagues could do. Let's use that cooperation and collaboration even among them, but teach it, practice it, allow them the space to see that it is the best way of doing things. And if not, their learning becomes compromised as it is. So we have this type of metric here that looks at the types of support. We have general support, we have intensified support, and we have special support for the IEP decision. This becomes really very, very important, in that you see that at the apex, there are very few people. That is where now we need to work hard to allow that to happen a lot, so that at the decision-making level, the relevant people are involved. If you are teachers and we don't take you into consideration when we get to decision-making, then we are making a terrible mistake, because, as I said, you are the custodians of knowledge. You have amassed the skills, and how best we can do that will be helping us a lot to make proper decisions, not decisions that we think we can make, from the desktop, from our offices, without consulting with the people who are interested. Ladies and gentlemen, I think for today, this is how far I can go. And I will appreciate questions if people do have any questions. Thank you so much. All right. Anyone? Any questions? Yes, Sue.
Morning, Prof.
Yes, my sister. Good morning.
So I'd like to ask a question about the current assignment that we are busy with. Dr. Liz has provided wonderful expanded guidelines for the assignment, and we're very grateful for that. But within designing an ISP or an IEP, we know that this needs to be a practical plan that
Yes.
the teacher in the classroom or whatever support structure in the school that exists can use in a practical way.
Yes.
But my dilemma is that I have a learner who is in grade 4, and yet all the screenings done for scholastic assessment shows that they are performing or the abilities they show is that of a grade 1 level. So there's no way I can expect a teacher of 49 children in a class to address the needs of somebody whose many concepts are at a grade 1 level while trying to teach grade 4, whatever the subject might be. So my dilemma is I can write an ISP that is leveled at the grade 1 needs of this learner.
Yeah.
But the teacher in the classroom won't be able to action that.
Why not?
Well, because she's got 49 children in the class, and probably half of them also have specific learning needs.
Yes.
So this is my dilemma. What guidance could you perhaps give?
It's a brilliant question, Sue. I'm just hoping that you are listening to my lecture, because I think what is going on in your mind is so burning, which I appreciate very much. I think you asked the same question also in the last class. Here is what happens. When you design your intervention, it has to be holistic. And now you are saying, what do I do with this particular learner? The question is, have you catered for those outliers in your design? And we are talking multidisciplinary teams, and you are saying the class is class 4, but the learner is operating at the level of class 1. Now, let's think multidisciplinary team. Have you catered for that eventuality that perhaps this is where now, as you are rightfully saying, the teacher cannot focus only on this particular learner at the level where they are? What else can you do? I have alluded to the kind of module program that we were looking at. It was actually for teacher support, someone who is going to support the teachers. That is a person that now can spend a lot of time helping this particular learner, maybe to catch up eventually with where the other class is while you are busy with this. But the catch here is that you should always be triangulating and finding out what are the problems that this learner is facing where they are, in case we are addressing one aspect and we are not aware of what the problem actually is. So I would insist that that multidisciplinary team approach would be very helpful. And I'm saying again, this teacher support student is the person that personally I would use so that they address this particular learner, but without losing focus that I am the overall responsible person who can bring this person on board. Dr. Lisa, I don't know if you would have additional comments to that.
Sorry, Prof. I think this is a very real problem that a lot of people are facing.
Okay.
It is grade 4 where all of a sudden people identify that children have not grasped the foundation concepts that they should have. And the grade 4 teachers themselves feel quite helpless because they've not been trained in how to
Yes.
teach some of those foundation concepts. So it's more a systemic thing that needs to be approached in a systemic way to try and bridge that gap and give some of the teachers the support they need, plus help the children, which is it is a problem at the moment.
Wow, that is very interesting. Okay, I see a colleague has also said that.
So Prof Max,
Yes.
so sorry, I love what you're saying and I agree with it wholeheartedly. But in the case of my case learner, and with speaking to fellow students, within the school this learner finds themselves, there isn't a multidisciplinary support structure that is functional. There isn't a functional school-based support team other than one that processes paperwork, which makes this complex. So I could say to the teacher, well, so-and-so needs to help and so-and-so needs to help, but there is no such people who are functioning in this role at the school. So on paper, I can put a beautiful thing down, which of course, for the purposes of this assignment, I can, but what kills me is the reality on the ground.
Yes, you see what Dr. Liz is saying is very true, that it looks like it's a systemic problem, but no one prevents you again to saying the system seems to be having critical issues here. How can I then focus my attention on helping the system to come up? I have come across a lot of students during teaching practice who would come to me to say, "Sir, this school is very dysfunctional." And in one school, I said the following to the student: "You have been here for a couple of weeks. What have you done to address this particular issue?" The student looked at me and said, "Sir, you expect me to do that?" I said to her, "Aren't you an agent of change as a teacher? If you are seeing that the context is not functional, you will go to classroom, you'll waste your time trying to think that you are teaching, and nothing will help." And I said to her, "I will give you a week. When I come back, let's find out what is it that you have thought of and what you have done that will bring about change." The students in that school were very unruly. Then this student decided to talk to the ringleaders and found out that there are children who come from problematic areas, and then decided to address those and made them the leaders of the class in terms of discipline. I can tell you now, that student turned around that school in that particular year. I don't remember what year it is, but when she was done with her teaching practice, the headmaster even said to her, "You are welcome to apply to our school. We would like to have you as a teacher here." When I went to assess the second time, I was told, "We want this girl here." Madam, in education, we can't resolve the problems on the ground. We can give you the tools, but it is up to you to think beyond what we do in the classroom to say, how best can I do, what is it that is best I can do to help that community to even start talking about the dysfunctional SBTS team? How can I help, with all that you have mentioned? Look at that and say to yourself, this is how best I can do it. Yes, we know that with the short time you are also given, you cannot resolve that. But perhaps you can sow a seed for change. You can sow a seed for support. You can sow a seed that will allow these people to resolve their problem and have a conducive learning environment at the end of the day.
So, Prof, if I can come in there and say, I have faced this problem quite often. So we have come up at one of the schools that I work at where the teachers have been open to the fact where I've actually taken the grade 4, 5, 6, 7, and 7 teachers, particularly the English teachers, and I've actually taught them some of the basics of phonological awareness, phonemic awareness and things like that. And they actually took it to heart and they try. So then when they come up with a particular problem, then they'll come back to you and ask you. So learning support actually is not just supporting the child, it's supporting the teachers in the school, it's supporting the parents.
Exactly.
And then we expanded it to a parent meeting where parents were invited, and then we said to them, okay, let us teach you how you can help your child in how to read, for example. And simple things, sounding out words and things like that. And the parents themselves learned how to read a little bit better and were then able to teach their child. So learning support is it's a very wide thing that you're trying to do. It's not just focusing on the child.
Exactly. No, thank you so much. I see Claire will be the last one. I know Doctor is waiting patiently also for her next class. Claire, can you make it quick, please? Oh, I see a hand, but it's not there. Okay, colleagues, we are at 3 minutes after 11. Thank you so much. Yes, Claire, do you want to say something? Okay. Yes, Lucy, do you want to say something quick?
Good day, everyone. I'd like to ask about the assignment that we have for designing the. I wanted to know in time or after you design the document, do you fill it in, or you just design it and you don't fill up the particulars of the land?
Lucy, you follow the instructions that have been given, because you are asking a question now that I might say you fill it in or you don't fill it in. I don't know the context within which you are. Do you mind? It's a Saturday now. I'm leaving for Gauteng, but send Dr. Liz and I saw that she has responded already, but send us an email, both of us at the same time, specifying exactly what is it that you need help with so that we can help you. All right? Okay, colleagues.
Prof Max, can you hear me?
Yes, I do. I do, Doctor.
I think Claire's microphone is not working, but she did post a message on the chat. I'm not sure if you saw about the buses that the Eastern Cape has for support.
I copied that. I copied that. Very, very nice. Yes, I copied that. We will actually follow that up with her. Thank you so much.
And Claire is a really good contact in the Eastern Cape for you, Prof, if you want to put that kind of collaboration in place.
Yes, it will definitely be, because we are working there. We have people who are actually very ready to help us there. But with Claire, I think we can do a lot. Thank you so much. Thank you so much for that. Colleagues, let me say that goodbye from us, and we will see you in the next class. Thank you so much, everyone. Thank you so much. Bye-bye.
Good morning, everybody. I do realize it's been a long day for you, so I'm going to give us a 3-minute